At the time of recording this video, 645,194 cases of COVID-19 have been reported globally, of which 475,688 are active cases, 139,550 have recovered, and sadly, 29,956 have lost their lives. What's up guys, my name is Addo-Teye and today I will be talking about COVID-19. Coronaviruses. Coronaviruses are a group of related viruses that cause diseases in mammals and bats. In humans, coronaviruses cause respiratory tract infections, some of which are mild like the common cold, whilst others can be lethal such as SARS, severe acute respiratory syndrome. SARS made its debut on 16 November 2002 in China and lost the spotlight in June of 2004. Another coronavirus is MERS, Middle East Respiratory Syndrome, which also grabbed the spotlight in April of 2012 in Saudi Arabia, but it seems reports of infections has reduced over the years. And lastly, we have the novel COVID-19, which stands for Coronavirus Disease 2019. Symptoms of coronavirus infections vary among species. In chickens, they cause an upper respiratory tract disease, whilst in cows and pigs, they cause diarrhea. There are yet to be vaccines or antiviral drugs to prevent or treat human coronavirus infections. Origins. Okay, so we know that this coronavirus pandemic started from China, but how exactly did it start? The first human infections were reported at the end of December 2019 in Wuhan, China. 66% of the cases had direct exposure to the infamous Huanan seafood market. There are two likely scenarios which map out a possible way the virus may have jumped from animals to humans. In the first scenario, the virus evolved to its current pathogenic state in a non-human host and then jumped to humans. In the second scenario, a non-pathogenic version of the virus jumped from an animal host into humans and then evolved to its current pathogenic state within the human population. Fresh new data released recently showed a 96% similarity between a virus from a horseshoe bat sample collected in Yunnan, China, and the COVID-19 virus. A second paper reported 89% similarity between the COVID-19 virus and a group of SARS-like coronaviruses previously found in bats in China. These similarities, according to scientists, are not enough to prove the direct origin of the virus. In such cases, an intermediate host is said to have played a part in the transmission, and for this current COVID-19 outbreak, all fingers point to the pangolin. Signs and symptoms. According to the WHO, the most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel sick at all. People have also reported losing their sense of taste and/or smell. About 80% of people who get COVID-19 experience a mild case, about as serious as a regular cold, and recover without needing any special treatment. Less commonly, upper respiratory symptoms such as sneezing, runny nose, or sore throat may be seen. Around 1 out of every 6 people who get COVID-19 become seriously ill and develop difficulty in breathing. Older people and those with underlying medical conditions like high blood pressure, heart problems, or diabetes are more likely to develop serious illness. In some cases, the disease may progress to pneumonia, multiple organ failure, and death. In those who develop severe symptoms, the time from the symptoms showing to needing mechanical ventilation is usually around 8 days. Transmission. Person-to-person contact is thought to be the main method of transmission for the COVID-19 virus. The virus is typically spread during close contact and via respiratory droplets produced when people sneeze or cough. According to scientists and doctors, coughs and sneezes can travel several feet and stay suspended in the air for up to 10 minutes. Imagine sitting next to someone with COVID-19 infection on the bus or in a meeting. Suddenly, this person sneezes or coughs. If they don't cover their mouth and nose, they could potentially spray you with respiratory droplets which may also contain the virus. Or perhaps you meet someone who has gotten the virus and they touch their mouth or nose with their hand. When that person shakes your hand, they transfer some of the virus to you. If you then touch your mouth or nose without washing your hands first, you may also get infected with the COVID-19 virus. It may also spread via a contaminated surface on which the virus can live for up to 72 hours. For example, an infected person sneezes or coughs into their hands and then touch an object, say a pen, a door handle, or a seat on the bus or taxi, or probably a table at the workplace. Touching any of these objects and then touching your nose, mouth, or eyes may potentially introduce the pathogen into your body. This is why proper and frequent hand washing is so important. It is most contagious when people are showing signs, although it may still spread long before the symptoms show. Prevention. The CDC recommends covering the mouth and nose with a tissue when coughing or sneezing, and recommends using the inside of your elbow if no tissue is available. They also recommend proper hand hygiene for any cough or sneeze, and this is where hand sanitizers are needed the most. Social distancing strategies aim to reduce contact of infected persons with large groups of people. So by closing schools and workplaces, restricting travel and cancelling mass gatherings, the risk of an infected person spreading the virus is greatly reduced. Social distancing also includes that people stay at least 6 feet apart from each other, that is about 2 meters. Slowing the infection rate helps decrease the risk of health services being overwhelmed, allowing for better treatment of current cases until a vaccine becomes available, which is not expected anytime soon. Like and share this video so others get to know this important information about COVID-19. Don't forget to subscribe if you have not and ring the little bell so that every time I upload a new video, you'll be notified. This is a public service announcement from the WHO. Do the 5. Wash your hands often. Cough and sneeze into your elbow. Don't touch your face. Keep a safe distance and stay home if you can.